And this part of our lecture I like very much. It is implementation of the programs of prevention of dental diseases in pregnant women in the condition of a big city. So, for example, we speak about our article, and now we will speak about the preventive. So we have in Ukraine different major dental diseases in a pregnant woman, and I think that it's not only in Ukraine and in your countries, maybe also. And during the physiological course of pregnancy, the prevalence of dental caries is 91.4%. It's very high level, and periodontal diseases occurs in 90% of cases, and defeat before intact teeth. Dental diseases. Of course, we have a different reasons of dental diseases in a pregnant woman. And of course, very important, it is observation of the pregnant woman. It is examination and early detection and treatment of the dental caries and different inflammatory periodontal diseases. It is preventive, it is professional oral hygiene. And we remember we learned about the professional hygiene one time to the 6 months, and sometimes in the pregnant woman we need to do it often because pregnant women have problems with the gums, with gingivitis and periodontitis diseases. And of course bleeding of the gums. And the previous part of our lecture I said about the changing of the hormonal levels during the all period of the pregnancy, all trimesters, and that is why we have different risks. Then observation of pregnant woman in the dentist. You can see in this picture that in Ukraine the scheme of dispensary observation of pregnant woman at the dentist was developed more than 20 years ago. And of course, when pregnant woman come to the doctor, to the hospital, of course, the therapeutic doctor give a medical card and give a consultation with the other specialties. In this medical card, we have also a dentist. So, getting a dental care during pregnancy limited to. You can see this picture, I don't read here. Of course, we need to have a special diet for a pregnant woman, and one of the earliest changes pregnant woman can make to look after oral health and overall health at all. And of course, firstly, it's diet. Cutting down on the how often and how much sugar pregnant woman consumer can dramatically reduce, for example, the risk of the tooth decay, and it also can make many other areas of our health, of the health of pregnant woman. Then switching to fresh fruit and vegetables is a great way to look after oral health. and also look after all of body. Then the purpose of the work was the development and evaluation of the effectiveness of the program of prevention of the dental diseases in the pregnant woman. Here we also speak about the materials and research methods. And the trimesters, the first visit to the dentist need to be at from 6 to 8 weeks of the pregnancy. The second trimester is the second visit to the dentist, and it is 16-18 weeks of the pregnancy. And dear students, attention! We have a different critical periods for the pregnant woman, and sometimes when pregnant women come to you and want to treat teeth, you need to understand how many weeks this woman have a pregnancy, and of course you need to understand when this pregnant woman can have a critical period. This critical period is very dangerous for the pregnant woman and child. And here between 22 and 28 weeks we can treat dental diseases in the pregnant woman, the plan of which was developed during the second visit. In the second trimester, the third visit to the dentist, it's 26-28 weeks of pregnancy. And after this, we have the second critical period when we can't treat anything. We can help only with the simple diseases, for example, with the bleeding of gums. We can give some treatment, a plan of using of drugs, of medication. And the critical period is the second critical period, 28-32 weeks. It's very dangerous critical period. And the third trimester is the fourth visit to the dentist from 36-38 weeks of pregnancy. And very naturally that we have a program for the prevention of the dental diseases. The first visit, remember, it is 6-8 weeks. We can to do a prevention of the periodontal diseases. So, why is dental health during the pregnancy is very important? It is important to take care of the teeth and gums during the pregnancy for the following reasons. Of course, as I said previously, hormonal changes, yes, and then gingivitis can lead to more serious periodontal gums or bone diseases. This can increase to risk for other health conditions. For example, it can be diabetes or it can be heart disease. Then, and of course, poor dental health may affect the general oral health of the developing of the little child. Research shows there may to be link between periodontal disease and having a preterm or low birth weight baby. These babies are a greater risk of having developmental problems such as asthma or oral infections, and may have a higher risk of infant death. So, how we can keep our gums and teeth? Though teeth can be affected by what pregnant women eat or drink, how often this pregnant woman eats or drink, how long the food stays on the mouth of the teeth, and how long a plaque builds up on the teeth of pregnant woman. Plaque is a sticky film, remember, that contains bacteria on the surface of our teeth. So to keep the teeth and gums healthy, of course, pregnant women need to brush the teeth at least twice a day with toothpaste that contains fluoride, and sometimes it will be better to brush the teeth more often than twice. Then clean carefully along the gum line where plaque sticks. So we can't prescribe a floss, it's necessary. Then choose to drink water between meals and snacks. Avoid frequent sipping on sweet liquids and, for example, acidic drinks. But of course, some of the meals, some of the drinks, it's not recommended in the period of pregnancy and also for other period. Then eat healthy food and limit foods that are sweet or can stick to our teeth, to the teeth of pregnant woman. And if pregnant woman eats sweets occasionally, try to eat them at meal time. Then, of course, it will be better to brush the teeth after meals and snacks during a day. If this is not possible, rinse the mouth with water or a special fluoride mouth rinse. Of course, pregnant woman, it's dangerous when pregnant women, for example, smoke or using vape, drink alcohol or use other things or special drugs that is not can pregnant woman use in this period. It's very dangerous. And continue to have regular professional dental care. And it's about the timing of the professional hygiene. And of course, we can use different types of the professional hygiene. Sometimes in some situation, for example, we need to use ultrasonic, yes, for dental calculus, and we can use airflow. For example, if pregnant woman is doing control for the oral cavity, it will be better to use airflow, for example, with such powder as glycine. It will be very good without ultrasonic. But sometimes when, for example, you can see a big amount of the calculus, of course, we can use ultrasonic treatment. Then the first visit is 6-8 months, and here we can to understand of the level of the hygienic knowledge and skills of pregnant woman. If this woman don't know some skills, we need to do the education. Then training and motivation for regular oral care. Then professional oral hygiene, and here we can use and choose our powder during the situation. Then correction of nutrition of the pregnant woman, and of course it's selection of individual meals of oral hygiene. Then, so caring for the teeth and gums during pregnancy is, of course, very important part of having health during the pregnancy, and regular dental cleaning and checkups are safe at any time during pregnancy, but sure to tell of course if a patient have some problem, need to tell dentist or dental hygiene that this patient is pregnant. So pregnant women of course need to say about the baby. So any pain, swelling or infection in the oral cavity shouldn't be and this situation need to be treated in a good way. Then treatment of the dental diseases. Of course, if patient, pregnant woman, has gingivitis, we have a treatment of gingivitis. What we can prescribe? For example, it can be herbal preparations with an anti-inflammatory and antimicrobial action. It can be different rinses which have calendula or oak bark, chamomile flowers, and solution, for example, with chlorophyllite and others. It's very good medications. Then, what we can prescribe? We can prescribe hydromassage of the gums with their herbs. It's also very good manipulation because we have a bad blood in the gums, and after this we have a dental treatment in the presence of organ indication. Of course, for example, if we have some situation, for example, that we can do after the pregnancy, of course, we need to give a patient time, give a pregnant woman time, but sometimes we don't have this way of the decide of our situation, and we need to give an organ treatment. So, and here I want to say about the X-ray. Of course, if pregnant women have a problems, for example, and a pain such as characterized pulpitis or periodontitis, of course, we need to do X-ray. But dental X-rays and local anesthetics for the dental treatment can be safely provides during the pregnancy. If X-ray are required, the lead prone used at the dental office will protect pregnant woman and the baby. And pregnant woman may require certain drugs for dental treatment, so it is important that dental office knows that this woman is pregnant. Then check with the pharmacies, dentists, and for example, healthcare provider to see which medication is safe during the pregnancy. And the second trimester of pregnancy, it is 16-18 weeks. Here a plan for the treatment of dental diseases has been drawn up. Rehabilitation of the oral cavity up 28 weeks of pregnancy, and starting with 16 weeks pregnancy in the dental chair, pregnant woman can be in the sitting position or in the position of the left side. So we need to do sitting position or left side, because the pregnant woman can have a risk of the different not good situation with the health, and you can see some and need to give some emergency help in this situation if this patient sit in your chair very straight. So it's not correct because doctor and pregnant woman can have problems. Then, and program for the prevention of the dental diseases, second trimester at 16-18 weeks. Of course, it's correction, the future mother diet, and we speak about this previously. Of course, it is individual hygiene. Yes, it is the special rinsing with alkaline solution, irrigation, minerals, waters. Then brushing teeth with alkaline toothpaste. Controlled brush and followed by the gel application, for example, rocks, medical minerals, and we speak about the remineralizing therapy. We can use tooth smooth for pregnant women also, and rocks, medical minerals at 15 minutes. Then we need to do self-controlled brushing daily for 5-7 days and applying gel for 15 minutes once a day. Then at the end of the second trimester, 26-28 weeks, first of all, it is evaluation of the effectiveness of prevention of periodontal tissue diseases. It's professional hygiene, then rinsing of the mouth, and here it's very interesting. We can prescribe the drugs that contain microorganisms of the genus, for example, Lactobacillus, Lactobacillus phantarum and fermentum, which are resistant to a high performance of pH and have proven antagonistic action relative Streptococcus mutans. And here you can see the medication that we have in Ukraine. It's Lecidofil, it's Lactoferrin Biopharma. Then the third trimester. Here's recommendation for care of the child oral cavity from the birth to the eruption of the first tooth. Then breastfeeding promotion, because it is World Health Organization recommendation, and prevention of the development of different inflammatory diseases in the periodontal tissues, in the bones, and treatment was performed in the presence of organ indications. Examined. So 211 pregnant women, and 33 pregnant women. What forms we use? It's a mother-child dental examination card. It's necessarily its first medical document that patient need to write. Then exchange the card of the maternity hospital and medical card, of course, of the dental patient. It's form number 043. And we determined first its intensity of the dental caries, then the state of oral hygiene according to the index green vermilion, and condition of periodontal tissues according to the index PMA. And we have a pregnancy observation group. Its main group. Here we have 22 pregnant, and control group. Here we have 21 pregnant. Then, and intensity of caries of the prominent teeth. So here is examination of the first trimester. It's examination of the third trimester. It's DFE. I'm sorry for the translation, but it's a picture, it's a photo. So DFE, first trimester. The the result. And here the hygiene of the pregnant woman is also a very high level. And periodontal the control of periodontal tissues in the pregnant woman. Here is first and second trimester. Its dynamics of the periodontal tissues in pregnant woman. And you can see it's before treatment and after treatment. And conclusion, the program for the prevention of the male dental diseases has led to reduce the increase of the dental caries by 5.5 times and improving oral hygiene and conditions of the periodontal tissues. And of course, I want to say about the pregnancy and periodontal diseases, because nearly 60 to 75% of the pregnant women have gingivitis. An early stage of periodontal disease, yes, if you know, that occurs when the gums become red, so there is main inflammation, and swollen from the inflammation that may be aggravated by changing hormones during the pregnancy. For example, if gingivitis is not treated, the bone that support the teeth can be lost and the gums can become infected. Teeth with a little bone support can become loose and may eventually have to be extracted, of course. Then, periodontitis has also been associated with the poor pregnancy outcomes, including the preterm birth and low birth weight. However, how periodontitis may lead to adverse pregnant outcomes is not yet fully understood. And, for example, if we speak about the pregnancy and the dental cavities, pregnant women may also be at risk for cavities due to change in behaviors such as eating habits. Women who have a lot of cavity-causing bacteria during pregnancy and after delivery, for example, could transmit these bacteria from their mouth to the mouth of their baby intentionally. Women who have a lot of cavity-causing bacteria during the pregnancy and after delivery could transmit these bacteria from their mouths to the mouths of their baby. In literature, name of this is window of infection. Then, early contact with these bacteria and to other sugars, such as from frequent snacking or taking a bottle to bed, can lead to early childhood cavities and the needs for extensive dental care at a young age. 1 in 4 women of childbearing age have untreated cavities. Children of mother who have a high level of the untreated cavities or tooth loss are more than 3 times more likely to have cavities as a child. Children with a poor oral health status are nearly 3 times more likely to miss school because of dental pain. How protect tiny teeth and how we can help? So, all health care providers, including primary care, pediatric and maternity care providers, may consider paying more carefully attention to oral health. Protection of the carers includes a mix of potential grabbing materials to spark awareness. Then oral health should be part of prenatal care, and tips on how to protect the oral health of their infant. Then I will wait for your questions. I want to see your synopsis with this topic. And thank you for your attention. Thank you for your time. I wait for a synopsis, and I give you your task later. After this video, I will give you a task in Google Class. Have a nice day. Thank you very much.